Hi, I'm Matt Morgan. I'm a board-certified veterinary surgeon at Veterinary Emergency Referral Group. Veterinary Emergency Referral Group, also known as VERG Brooklyn, is a multidisciplinary 24/7 specialty hospital. As a board-certified surgeon, my day-to-day work consists of really doing complex surgeries. I started using VETIGEL about 3 years ago. I saw a demo video, and from that point, I was very intrigued and wanted to try it. So far, I've used VETIGEL in thoracic cases, abdominal cases, neurosurgery cases. It's a product that is biocompatible. It's a plant-based polymer. VETIGEL has unique properties that make it a flowable gel hemostatic agent, which is unlike the previous hemostatic products that we've used before, because it can get into really tight places where sometimes the bleed is really hard to access and to get to. A few patients come to mind when thinking about using VETIGEL in a life-saving situation. One that is most famous and the one that made the local news here in Brooklyn was a Yorkie that was stabbed, had a significant bleed. We treated with VETIGEL before surgery in order to stop the bleeding and stabilize the patient. That patient did very well, ended up not even needing a blood transfusion and was discharged about 12 hours later. Things like cholecystectomies, liver lobectomies, I'm pretty much using VETIGEL every time on those cases. It does save some time as far as just getting the bleeding stopped faster and be able to proceed with surgery, getting anesthesia time cut down. I'm a big fan for those specific procedures. The other ones that we do use fairly frequently are things like enucleations. There's specific steps that I tell people to use when I'm instructing them with it. And number one is making sure that we have the blood removed from the area before application, so you create that complete seal over where the vessel is. The second, third steps that I instruct people on is that when we're placing it, more is better. So using the entire syringe. If you do have an incomplete seal, then using a damp gauze and just gently placing on top of the VETIGEL and pushing down can create that seal and help with any bleeding that's coming from around the area. I've been a surgeon for the last 13 years. I was trained at Cornell and St. George's University. I've been living here in Brooklyn for the past 5 years. I serve as a captain in the U.S. Army Reserve in the Veterinary Corps. So I'm a veterinary surgeon for the military as well. This is a great product that gives me a little bit extra confidence in the OR when I'm dealing with a little bit more of a high-risk case. It's something where we're stocking this in the OR on a routine basis and having it available. It's something that doesn't need to be mixed or something that doesn't need to be warmed up before use. It can be handed to you by your scrub nurse and used in seconds. It has kind of filled a void that we've never had a product for, and something that gives me a little bit more confidence.